Good evening. I'll be discussing Hansen's disease, or known as leprosy. Hansen's disease is also commonly known as leprosy. It is an infectious disease caused by a bacteria that is called Mycobacterium leprae. It is an acid-fast, gram-positive, rod-shaped bacteria. Acid-fast means that it can cause tuberculosis and other mycobacterial infections, while gram-positive means that the bacterium can produce a gram stain. So when you look at it under a microscope, it'll look purple and in the shape of little rods. Leprosy mostly affects people ages 5 to 15 and anyone over the age of 30. Around 208,000 people have known cases of leprosy and are mostly found in India, Africa, and Asia. It can take anywhere from 2 to 4 years for leprosy to incubate and start showing signs. In 2009, a human skeleton was discovered in India. After careful observation, it was found to be around 4,000 years old. The skeleton was found with the same erosion patterns as other lepers dating to the Middle Ages. By around 1200 CE, there were 19,000 leprosy hospitals set to treat the disease in Europe. It was thought that around 4th century BCE, Alexander the Great's army contracted the disease when they invaded India. It was also thought that the army of Pompey brought the disease from Egypt to Italy. Between 11th and 13th century CE, Baldwin IV, also known as the Leper King, was thought to be the most prominent victim of the disease. Those who contracted the leprosy were thought not to be wealthy and had to live in houses called lazarettes and leprosaria for isolation, where they would wear signs and ring bells to let the healthy people know of their approach as they wandered the streets. It was called the living death because victims were treated as if they had already died. In Norway, 1873, Gerhard Hansen identified the leprosy bacillus where 2.5% of the population around him had already gotten it. In the 1980s, members of the WHO sought to treat leprosy with a multi-drug therapy that was 6 months to a year long. Leprosy is a slow-growing bacterium that can take 2 to 8 years to show symptoms. It was mostly found in less developed countries. It was unclear how leprosy spread, but it is assumed to be spread through droplets in the air with long exposure times. It is more common for children to contract the disease than adults due to their weaker immune systems. People who have been around or handled armadillos have a higher chance of getting leprosy. Scientists found over 100,000 armadillos carry the bacteria. Risk of leprosy goes untreated can cause paralysis, blindness, disfigurement of the nose, shortening of the hands and feet, ulcers, and nerve damage. There are 3 different types of leprosy. The first is tuberculoid Hansens, which is a mild case where the immune system responds well to the disease. It has a few lesions and some nerve damage, but it has potential to heal on its own. The second is lepromatous Hansens. The immune system does not have a good reaction with the disease, and this is the severe type that affects the skin, nerves, and organs. It is also known as the more contagious type. It can also not heal on its own and will cause hair loss, paralysis, weakness, and disfigurement if it goes untreated. The third is borderline Hansens. This shows features from the first 2 types and is the in-between type. This one can go either way and resolve itself, or it may progress into lepromatous and be irreversible. Symptoms are numbness, paralysis, permanent disfigurement, muscle weakness, nerve damage, blindness, lumps and bumps on the skin, and painless ulcers. Testing for leprosy can be by skin biopsy, cardinal signs, and symptoms that are typically the only way to test for it. Cardinal signs are some of the first detections of leprosy. The first sign is loss of sensation in a pale or reddish skin area. The second is a thickened or enlarged peripheral nerve with loss of sensation or muscle weakness and paralysis from the nerve. The last is taking a sample of a slit skin smear and looking at it under a microscope to test for bacilli. A slit skin smear is where a small incision is made in a lesion for the fluid to be tested. A possibacillary leprosy case will show 1 to 5 lesions and have no bacilli present in the smear, whereas the multibacillary leprosy case will have more than 5 lesions or has nerve involvement that can have presence of bacilli in the skin smear. Leprosy can be treated with a multi-drug therapy that includes rifampicin, dapsone, and clofazimine. People with this disease, if they have PB, will start with a 6-month treatment plan, and people with MB will start with a 1-year treatment plan of the multi-drug therapy. Early detection of leprosy can be the best way to prevent it from getting worse, while the best way is staying away or having proper PPE on around people who have diagnosed leprosy. It is hard to contract but can be prevented from spreading. In 2023, 165,459 cases had global prevalence. 174,087 new cases of the disease was mostly in Asia, Africa, and South America. There has been a gradual decrease in cases since the 1980s, where there were more than 5 million reported cases according to the WHO. The WHO has made the multi-drug therapy free for those who have the disease since 1995. The WHO also has a goal to eliminate leprosy between 2021 and 2030. In 2023, Brazil, India, and Indonesia have reported more than 10,000 new cases. 12 other countries have reported around 1,000 to 10,000 new cases, and 56 countries have reported 0 cases, while 112 have reported fewer than 1,000 cases of leprosy. Around 2/3 of new leprosy cases are found in India alone. If a country has a few cases, it is most likely from the people who have traveled to the country with a high amount of cases, or someone who has come to a country from a country that has a high number of cases. If leprosy has gone untreated for a long time, it can cause physical changes in appearances. This will cause social exclusion, isolation, and deteriorating mental health. Due to social stigma, leprosy can cause mental health issues in those affected with the disease and the family members of those who have it. People with leprosy are typically discriminated against and will be set to isolation from the population due to misconceptions. Lack of knowledge, age-old beliefs, and fear have made people have irrational behaviors towards those with leprosy. Many believe leprosy is incurable, with those who have it were seen as sinful people, and it was God's way of punishing them. In Hinduism, the Manu Smriti said that if someone has leprosy in the family, then they cannot have matrimonial alliances with that family. In Christianity, the Holy Bible has several references to leprosy, saying that it is a divine punishment for sins. Islam states, "Flee from the leper as you would flee from a lion, as leprosy is transmitted quickly and kills the one who catches it." And Buddhists call it a karmic disease. Leprosy, a lot of misconceptions around leprosy. Leprosy is not highly contagious, and it takes a lot of time around someone that is infected. Since we assume it is transmitted via droplets, wearing a mask and glasses can help prevent it if it is a concern. A lot of people actually are immune to leprosy. Leprosy can be cured with antibiotics from the multi-drug therapy and is gone in 6 months to 2 years depending on how severe the case is. Unlike the Unlike how the religions think leprosy is from God, it is actually a slow-growing bacteria that can be treated. Leprosy can affect anybody, no matter the age of social economics. There are new cases popping up in less developed countries because they are not able to get the same resources to eliminate the cases as fast as more developed countries. But according to the WHO, it is free, but it takes a long time to treat. And as it goes, limbs will not fall off due to leprosy. Leprosy can, however, cause severe inflammation and infections that may lead to amputation, but it is not the sole reason limbs fall off. Overall, leprosy, or Hansen's disease, was discovered by Gerhard Hansen in 1873. It was found to be a slow-growing bacteria that takes years to develop signs for. Early detection is the best prevention from spreading and making it easier to treat. Leprosy can be treated with a multi-drug therapy of antibiotics over 6 months to a couple of years, depending on the severity. It is hard to spread and would need very long exposure times to people or armadillos if infected by it. We are able to test for under a microscope with a skin smear, as well as seeing cardinal signs. The WHO is looking to eliminate the disease by 2023.